On today's CWN Medical Moment, we are at the TMH Heart and Vascular Center with Dr. Geoff, also called Dr. G. We are talking about heart failure. So, Dr. G, tell me, how does heart failure occur?
Well, heart failure occurs when the heart is not able to keep up with the body demands. So, and usually it's associated with people start developing symptoms, which could include shortness of breath or swelling. No? That's usually when it occurs.
Okay. Are there any populations that have more of a propensity of getting heart failure than others?
In this area of the U.S., African American males are especially propense to heart failure, elderly patients, and any patient who have had a cardiac event, which could include a myocardial infarction, or have propensity to develop heart failure. Also, sadly, in this region of the U.S., the diet plays a key role in developing of heart failure. Sadly, we have a very high salt intake on patients as well as high fluid intake, which that also, sadly, is a key factor for heart failure development.
Right. It complicates things.
And complicates things, yes.
Yes, yes. So what are some of the treatments for it?
Well, the American College of Cardiology has a long list of medications that patients with heart failure should be on, which are mainly blood pressure medications, and diuretics are also included, as well as diet and fluid restriction. Sadly, in Tallahassee, because of the warm environment, it's difficult to restrict the fluid intake, but if we can at least educate patients with salt intake, I think that would be a great achievement.
Okay. And what about any prevention measures?
Well, if patients start developing symptoms, which could include lower extremity edema, swelling, chest pain, shortness of breath, the key is to patients to touch base with their primary care physician, to make sure that there's no underlying condition, heart condition, which could explain the symptoms they're developing.
Okay. Dr. G, tell me about some of the resources here at TMH to manage heart failure.
Well, at TMH, we have 2 dedicated programs to assist patients with heart failure. One of them is called the Transition Center, which is directed for patients mainly with no insurance or no primary care physicians, which they are assisted throughout the first month after hospitalizations to make sure that all the medications they need are given to them. Also, we have the Heart Failure Clinic, which was created 5 years ago for patients with recurrent events, and it's a team of physicians, nurses, nutritionists, and social workers, which the goal is to assist, educate, and teach patients with recurrent events of heart failure. The clinic is about to be relocated a couple of blocks away from TMH, and the clinic is open 5 days a week, and we're here to help in any way that the community might need help.
Well, thank you for sharing that, and thank you for taking time to talk to me today.
No, thank you very much.
Okay. Stay tuned for more conversation.